go ahead and get started. So thank you all for being here tonight. If you would just stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And then if you would close your eyes and bow your head. Our Heavenly Father, thank you for allowing us to meet here tonight and everything that you do for us and continue to do for us. I ask that you watch over us and guide us in a way as we make decisions that are pleasing to you, Lord. I ask that you bless the hands that prepared the food for us. May it nourish our mind, body, and souls to the betterment of your service, Lord. In Jesus' name we pray. Amen. Next, we have the approval of the minutes for our September meeting. Everyone should have received a copy from Carla, or either picked one up as you came in tonight. Is there a motion to approve? Okay. Dr. Smith with a motion to approve. Is there a second?
Second.
All those in favor say aye.
Aye.
All those opposed. And the minutes for the September the 12th meeting is approved. Next is the approval of the agenda. Motion to approve. And second. All those in favor say aye.
Aye.
All those opposed. And the agenda is approved. Moving into old business, is there any old business to discuss? All right, hearing none, we'll move into our division report with the State of the County Health Report with Stephanie.
All right, good evening, everyone, and I am happy to do a presentation tonight on the 2021 State of the County health report that we put together this past year. These are always a bit delayed. They're due in March of the following year, so it was due in March of 2022. And, you know, we usually wait until we get approval before we present this and put the report together. So I'm just going to go over some of the highlights and summarize a few things in the report. Everyone should have one. Does everyone have one in front of you? Okay. Fabulous. All right, so just a summary of what the State of the County Health Report is. First of all, we do this annually, except on the years where we do our community health assessment. We're actually in the process of doing our health assessment, our 2022 health assessment. So we did do the State of the County report this past year in 2021. And the report is really a summary on the progress of our community health improvement plan, which I'm going to talk about in a minute, and just anything new or updated with morbidity and mortality changes in the county, any emerging issues, and any new or paused initiatives in the county. So I'm going to just move forward. Just a quick review of what our Community Health Improvement Plan is. So the Community Health Improvement Plan is really an action plan that comes from our Community Health Assessment. So our Community Health Improvement Plan that we are currently working on is from our 2019 Community Health Assessment. And within that, we have two focus areas that came out of our health assessment that we have action plans on. One of them is access to care, and the other one was priority area was mental health and substance use disorder. So we're going to just look real quickly at the different focus areas, priority areas. So the health improvement plan has just strategies that we are looking at in our access to care area. We're going to start with that. And within each strategy, we actually have some action steps that we took. And so with strategy number one of our goals was to increase the use of mobile units to go into underserved communities and to provide care. Remember, we put these together pre-COVID. And so some of our strategies that, or action steps that we put together were, again, to put the mobile units in the community And, our first year in 2020, we really weren't able to do a whole lot because of COVID. And even the beginning of 2021, we weren't able to do a whole lot. But as the year went on, we were able to do more. And so some of the mobile units we had in the community included our vaccination, COVID-19 vaccination mobile units. We also did lung cancer screenings via Atrium. We had a mobile mammography unit with Charlotte Radiology. And so what we're working on, always looking at, is doing some more in the community to go into the community where people, so we could serve that underserved community. Our second strategy was to develop some infrastructure and subcommittees from our Healthy Union Advisory Coalition. Now, that coalition was put together with the purpose of getting people in the community together to review our community health assessment as well as our health improvement plans, and make sure that as a community we were actually following the plan. We didn't have a Healthy Union Advisory Coalition before 2020. Actually, we started it in the fall of 2020, and really we're still working on some of the infrastructure for that coalition. And so we put together some work plans and subcommittees and held some monthly meetings. And toward the end of 2021, we actually started doing some presentations, secondary data presentations for our community health assessment. So we, again, the secondary data is statistics and information that's collected on the state level, sometimes on the national level, et cetera. So we did that. With strategy number 3, we put some education, prevention, and awareness campaigns out in the community. And during the course of 2021, again, we did twice as much as we did in 2020 in terms of providing that education out into the community. And we did some of that through our pop-up clinics that we did for COVID, but also as we opened our building here at Human Services I think in April of 2021 for DSS services, we always kept it open for public health clinics. We actually had tables up front with information about breast cancer, flu vaccinations, diabetes education, STD education, heart health, tobacco prevention, et cetera, so that we utilized the table out front to serve the community that comes in here and get education out. We also did a lot of campaigns on social media with our public communications, and that included information on breastfeeding awareness, the opioid crisis, ovarian cancer awareness, Alzheimer's awareness, domestic violence awareness, mammograms, diabetes awareness, and AIDS awareness, and many other chronic diseases. So we put a lot of that information out on social media. Our second priority and focus area for our community health assessment is mental health and substance use disorder. And again, our first strategy was on awareness and education. And we, just to give you some information, Atrium Partners and UCPS, our public schools, actually do mental health first aid, and we're able to do some more classes in 2021 than in 2020. We posted awareness information out into about mental health disorders and even substance use disorders in our e-newsletter Horizon, which we send out every week to the community. Union County Schools started a Start With Hello campaign to bring attention to social isolation and to empower young people and create a culture of inclusion and connectedness. And there were about 10 social media posts within a week period of time. They did a bullying campaign and have an anonymous tip line to report any crises. UCPS also has 4 mental health clubs at different high schools, which is another area. And then Partners Health Management provided some classes in suicide prevention, mental health and substance use disorders, and Mental Health 101. Our second strategy on here is our Behavioral Health Collaborative, which is the collaborative between the schools and DSS. We have additional social workers and therapists that we've put in the schools. And what's been wonderful about that is we've been able to increase the number of students that have been served with mental health services in the schools between 2021 and 2020. And also that group has done lots of presentations for parents and staff and students in 2021 as well. Our third strategy is around tobacco and vaping awareness and education. We've really focused that primarily on the schools. So we've had a collaboration between the health department and the schools, and we've really focused with the schools on changing their curriculum. So their curriculum didn't have vaping in it. They were using a curriculum that was back from 2012. So the schools have been working real closely with their internal committees on putting better curriculum together around vaping, since it is quite an epidemic amongst youth. And so they've actually done a little bit of that in the elementary school level already, and working on the middle and high school level. They've developed a parent education webinar, and actually we did a webinar in collaboration with the schools in April of this past year, so not in 2021, but in 2022. We did a lot of the work behind the scenes. And then we also worked on updating the survey that the schools send out at the end of the year to add some more specific questions on tobacco and substance use. So we were able to modify some of the questions on there to be a little bit more specific. And we also were looking at adding some additional mentoring programs this coming year. And in addition to that, before COVID started, in fact, a couple of weeks before COVID started, the schools had agreed that the middle schools were going to bring in a student speaker to talk to them about vaping. And obviously, because of COVID, we had to put that on hold, but we're excited. We're going to bring that speaker in probably in January or February of 2023. But that was something that we had started back in 2020, and we're continuing discussions about in 2021. And we also did some awareness campaigns, again, through our public communications here on nicotine addiction, how to quit smoking, the risks of vaping, e-cigarettes, and information about Juul. And then our last strategy here is on our countywide tobacco ordinance. And we did revise that, and for those who are on the committee, this committee here may remember that we actually revised that and brought that back in July of 2021. And we also presented information to the board, county commissioners, back in January 2022. There are a few concerns about it, so we are going to hopefully bring that back to the board later this year, maybe in the next month or so. So we're still working on a lot of these, but did make some headway in these priority areas. This slide also talks a little bit more on just a summary of what I just talked about, really. Okay. Within the report, there's a lot of information about morbidity and mortality rates. There's actually a whole chart in the report there. But just to summarize, a few points here. Cancer continues to be a leading cause of death in Union County. Breast cancer and prostate cancer death rates are higher than the state average. They're not a whole lot higher, but they are higher. Diseases of the heart and motor vehicle death rates are somewhat lower than the state rate. And I know that this has been brought up a number of times in the meeting, but the COVID-related deaths were higher in 2021 than they were in 2020. So those were just summarizing a few of the points in there. There are some more in there in addition to that. So just jumping into some of the new initiatives that took place during 2021. Again, we launched our 2022 community health assessment presentations of our secondary data in our Healthy Community Coalition meetings. We started that in 2021. We had 3 presentations. We actually completed our presentations in August of 2022 and did our priority setting last month, or actually only a couple of weeks ago. So that was one initiative. Another one was education and vaccine outreach into the historically marginalized community. And, you know, I know that we also did lots of outreach, mass vaccine clinics in 2021 at the very beginning of the year. We shifted toward just reaching out to priority areas. And, you know, worked real closely public health, and I know my unit worked real closely to bring that, and Atrium to bring that out into the community. And then also, you know, working real closely with environmental health too, looking at assisted living communities, group homes, skilled nursing facilities, jails, just making sure, homeless shelters, making sure that the vaccines were available out in the community to some of those areas. Communicable disease outreach campaigns. I know that you had a report not too long ago about STDs in the community and the increase in 2021 over 2020. So we know that during COVID in 2020, we didn't see much of a jump, or actually saw maybe reduced screening and also just decrease in number of cases. We've seen an increase in the last couple of years, and so wanted to make sure that we got out into the community. I know that public health has been working real hard on getting outreach into the community, educating different providers on some of the new guidelines around sexually transmitted diseases, and also want to make sure that we're expanding data out into the community. I think putting together community health data is looking at trending much in the same way that we were doing with COVID. So that was something that was planned. And then another area that we had initiatives was in the childhood immunization outreach. Basically, we did not meet our benchmarks in 2021, probably because of COVID. So I know that we put an action plan together and reaching out into the community to, you know, really target staff, local providers, doing annual training in the county, have put some other immunization information out via newsletters internally and also externally, have worked collaboratively with Union County Public Schools to coordinate vaccine clinics, have done back-to-school clinics every year, and have done some social media outreach. Yes.
So we just actually finished that, and Michelle has some exciting numbers that I think are worth
Okay,
going ahead and
great.
inserting at this point.
Yeah, so every year for the back-to-school clinics, we work with the school nurses very closely they identify the kids that don't meet the requirements for, or the vaccine requirements, and those kids are kindergarten, 7th grade, and 12th grade. And they send notifications out numerous times to the families, but still there are some people that for some reason, whatever reason, can't get the vaccine, or the families just haven't gotten the message somehow. I'm sure teenagers hide it, but anyway. But we had so on the 28th of September was the exclusion date, so unless you were up to date on your vaccines, you couldn't come back into school. So we had an open vaccine day. Just walk in, and this whole room was filled with vaccine tables, and we gave vaccine to 179 individuals, but about 407 vaccines that day.
Wow, that's great.
Yeah.
Excellent.
I have a question.
Yeah.
I don't know what percent of students in the county are in charter or private schools, but when you're saying the outreach to schools, is it all with the public school system?
I'm going to let Michelle.
It's to everyone.
Everyone.
Okay.
Yeah, we work with everyone.
The last initiative I just want to mention was our substance use disorder. That's what SUD means. Root Summit planning. So we didn't have the summit until April of 2022. but we were planning this in 2021. And so basically, I mentioned before, part of our Healthy Union Advisory Coalition included subcommittees that we put together. One of them was our Substance Use Disorders Subcommittee, and just felt like we didn't have the right players around the table, and so just thought about how we could really get the community together and talk more about the issues and concerns and the gaps in services and the needs in the community. And Wingate University does a Root Summit every year around one issue that is prevalent in the community. And so we use the Root Summit to be able to get that group together and talk more about that. So again, the goal was to map out services in the community, look at gaps, and just lay some foundation so that we could start strategically planning around that. And we've actually used some of that data in our opioid settlement task force that we have together now. So that was really helpful to have that information. Some other new initiatives in environmental health are listed here. I know that Tracy presented some of this information probably about 3 or 4 months ago, I believe, in a lot of detail. And there's a lot of information in the book there, so I'm not going to go through it, but these were the different areas that she did talk about during her presentation. I don't know if you want to add anything, Tracy, but no? All right. All right, and so emerging issues, like I said, 2021, we're still in COVID, but also coming, we still continue to see some of the impact of COVID on our community, on our kids, and, adults, everyone. And so substance use disorders and behavioral health needs are definitely something that we knew was an issue, but saw more emerging out of COVID. We saw the impact. Luckily, in our community, we had school most of 2021 with the kids in the classroom, basically from late April forward, 5 days a week, and prior to that, 2 days a week. So we didn't see as much of the impact on education as some of the other counties, but we certainly did see some deficits and issues. So that's definitely something that we knew was an emerging issue in the community. We know that people delayed coming for preventive services and health care because either A, they couldn't get appointments because they just weren't available, places weren't open. So we knew that was emerging. And we also knew that Medicaid reform was, and access to care was an issue. They were supposed to jump in and start Medicaid reform back in 2021 and delayed some, or 2022, and delayed a lot of that. So we knew that there would be some issues as a result of that. And then just to mention, we did have a few paused initiatives, and these were paused from the year before as well. But we did start a health equity committee back in 2019, and we had already decided that we needed to revamp this committee, and so we were supposed to meet back in March of 2020, and of course that was put on hold, and we really decided to fold in anything related to health equity really into our Healthy Union Advisory Coalition, and not have a separate committee around that. And then our Minority Diabetes Initiative, again, we had just launched that in, I want to say we were launching that in March of 2020, or going to, and we put that on hold. That initiative is a collaboration with Cabarrus Health Alliance, and so that was put on hold again because of COVID and their ability to get that started. I believe we're going to kick that back off actually in the next month or so. I think we just signed an MOU again with Cabarrus, so I'm excited that that'll actually be restarted. So, but that had to be paused for a lot of reasons, and that's pretty much it in a summary. And again, you have the book here that you can read up a little bit more. This is also posted out on the website, and we're going to be putting some of this information out into the community, some of the public libraries. And that's about it. I don't know if anyone has any questions. I don't know that I can answer. If I can't, then I'll come back in with the information.
I have a question. On the priority area 2, under the mental health, like strategies 1 and 2, when you spoke about the mental health first aid in partnership with Atrium and Union County, right? And different initiatives that Union County schools have started. And then on the behavioral health collaborative, I think it was similar. Like, I wanted to find out if the behavioral health collaborative how we're doing the school-based mental health initiative for SHL. Okay.
We're doing that, but I know also that Atrium now is providing some telehealth services at some of the schools too. I think 3 or 4 schools right now. Is that correct, Missy? And so that's just another alternative for some of the kids as well.
So on either of those, is there any kind of anything outside of the school system on the mental health awareness and education, or you know?
So we actually did just start up a committee, a mental health committee, and really looking at crisis and how we're addressing crises in the community, and looking at services and gaps in services and so forth. And that is also part of the mental health subcommittee of the community health assessment too, just really looking at some of the needs. We know that there are lots of issues around insurance, lack of insurance, underinsured for mental health. You know, a lot of the mental health providers don't even accept insurance, and so people can't afford to pay out of pocket. And you're talking about adults, not just children, and I think that's maybe where you were going. So we're certainly looking at some of the issues that we're seeing in the county in that committee.
Stephanie, is there a social services report that's similar to this human services report? I mean, I would love to see something that would report on the state of the family in the county, because I feel like that the state of intact families and the state of what social services, folks are doing continually has a tremendous impact upon the health in the area. And I really think we should talk about those things together and look at them together, because they influence one another tremendously. And, and what can we do as a county to try to encourage intact families? I think that's the elephant in the room. People don't want to mention a lot of times, but I think it's really important that we look at that and consider that. Do we have a social services report on the state of the county in that regard?
I'm gonna have Ashley Fick.
We do not have a report that's put together like that. We report every month to the state and also to the county and to the feds, all of our stats. So we have all of the data and we have it compiled together, but it's not put into a nice little book like Stephanie has done for the state of the county health report. So if you're interested in those, I can pull them together and have them at the next board meeting.
I think it would be great for us to look at that and just to see them together and see how all these factors play a role.
I don't know that I can meld it together with the state of the county health report, because that's a mandated report that we have to submit. Right. But I can provide you with the DSS version of that. Does that work?
If we could do that, and then we already got this report, and if they're similar time periods anyway, I think it would be great to just analyze that and think about what can be done to encourage families to try to stay together. There's
that's good. I like it.
A lot of impact, that it has there. Thank you.
Does the DSS report, would that give insight in how we're doing on social determinants of health for different families that can be the, cause of why?
Somewhat. So you're going to get information from economic services on the number of families that we're supporting through programs like Medicaid and food nutrition services and child care subsidy. The only information and data that you're going to receive in regards to child welfare is going to be families that were referred due to child abuse, neglect, or dependency. So I'm not going to have information on every other family in
So-
Union County.
I can tell you that part of the process to do the community health assessment is pulling that data together. So, and we'll be in the community health assessment. So we definitely look at all the social determinants of health. You know, we look at poverty and insurance and housing and, you know, just all the different areas that could impact the ability of folks to, you know, thrive in our county.
And I
So-
think that honestly might be more what you're looking for, Mr. Smith.
That's what I,
And that's in her other report that I believe that she's working on.
and that'll release in 24 though? Like,
20, well, no, we actually have to submit it in March of 2023. You know, I certainly have some of those statistics now, and I could present some of those social determinants as well.
So the information I would be able to provide you with, Mr. Smith, would be very reactive. And it sounds like you're looking for things that we can do more proactively. And I think you'll find that in the community health assessment.
Right.
Mine is going to show you, I had this many children referred because there were allegations of child abuse and neglect. And here's what happened. Here's those who came into foster care and those who didn't. We are able to close the case, but it's not going to show you that we have this many kids in poverty in Union County, and if we were to make an impact on that, we could see this happen. I think you're going to get more of that from the community health assessment.
that's what I think too. That's why I was asking if yours would have that.
Yeah.
So that would be spring though? But you could share some in the room.
I could share some of that.
Still happy to bring an annual report for DSS to the January meeting, and I'll just do it for 2022. Just let me write that down so I don't forget.
And Stephanie, I just had a question about what, I know you mentioned social media was being used to promote a lot of the campaigns and everything. I was going to ask what outlets we were using, like if you know if we're using like TikTok to engage like the younger users for educational purposes. I know that's starting to be a new thing for the education side of things. And if not, if we're just using like things like Facebook, Twitter, Instagram, do you know what we're doing to like bring the attention to the site to get people to look at it?
I may ask Nicole to jump in a little bit here.
Yes, so we have Facebook, Instagram, Twitter, and YouTube and Store are the social media channels that we use most frequently. And a huge thing we want to start doing more of are Facebook, Instagram stories and reels. Stories are those 24-hour little things, and we're talking, doing some of that now, but we're going to start trying to do more reels and get some of the information out that way. And we'll need to make it young.
And I will say, we've also, some of the information we've gotten out there, I know some of my staff have actually gone out into the communities to distribute information, knocked on doors, and provided it, so like real boots on the ground for people. We do send information to, you know, a lot of the churches and other providers that we collaborate with so that they can get it out to their target audience. So sometimes even printing, you know, sending information out, and, you know, some of the food pantries will print it out and distribute it while people are waiting on lines. You know, just really trying to get that information out when the people are there.
I was just thinking of like social media, people might not be prone to follow the health department on it, just finding a way to encourage them to get connected so that way they will see the information. That's all I had.
Yeah, and that's why it's so important to have boots on the ground and really go in the neighborhoods to distribute information. And we've been out near Walmart and laundromats and, you know, posted information just kind of out wherever we know people are at.
Any other questions? All right, we'll move into the approval of requested public health clinical service fees with Janet.
Good evening. I'm actually going to turn this one over to Michelle McGrath. Don't think that there's any trick items, but we do have 13 fees that we would like to bring to you and ask for you to endorse and approve our taking them to the Board of County Commissioners for final approval.
Hi, everyone. So the majority of these, all but two, are COVID vaccine administration fees. But the first, I'll start with the others. The first one is for the rabies pre-exposure vaccine. This is not a new fee. We're asking for approval for an increase in our current fee. Right now, our fee is around $240, I think, and that is actually lower than the cost of the medication. So we're a little behind the times. It's been steadily increasing, and we're making a recommendation to increase that fee.
Is that the one increasing to 507?
Yes.
Is that how much it costs, or is that?
Well, it's variable. Right now, it's $297. That was the price that we had listed today, but it's changing a lot. Sometimes it's $350, sometimes it's $280. Okay, and next we have the quad screen. This is a screening test that we do for our maternity clinic. It's typically done in the second trimester, and it's just a screening for various birth defects. This is an old test. We've been doing this for many, many years, but the state used to process this for us, and they're no longer doing that. That was under a grant program with Wake Forest. So we've had to pick up that, need to pick that test up ourselves. And then next we have a variety of vaccine administration codes. These are, some of these have been actually approved from the FDA since the summer, but we've just kind of bundled them all together. And these are for the children Pfizer and Moderna vaccine, and also the new Novavax vaccine, as well as the Pfizer Moderna bivalent. Does anyone have any questions about them?
The only other thing I'll add for you, since I don't think that we've presented any fees since you have been on the board, is in regard to the first two, which are not administrative specific. The way that we arrive at the dollar amount is basically adding 30% to the approved Medicaid reimbursement rate, and I believe we added that note in the description here. But that is to help recoup our administrative overhead costs. And so in terms of thinking about the specific rate for the cost of the rabies vaccine, that was number one that you asked about, that is fluctuating. The way that we arrived at that $507 is based off of Medicaid reimbursement plus 30% allowable admin.
Will that allow recoupment of some of the losses since it's way under currently, or is that how it's figured a little bit too?
It is, and it's also the storage and handling, the time it takes to manage just the storage and handling of the vaccine and the reporting of the vaccine, like temperatures to the state, that kind of thing. So there's a lot of oversight with vaccine inventory, and that covers that.
In our, was it last month that we talked about rabies when it came? I guess that's the only concern that I would have, right? I mean, because when you're talking about $500 for preventive, like at what point do you cross the threshold that someone's not going to be doing it that needs to, right, with some of the farmers and stuff, and what would be the
So, yeah,
cost
that's
of
that's
that?
a question that we've talked about for a long time. But right now, this fee is actually a fee for our clinic, our vaccine clinic, immunization clinic.
Okay.
So this fee we will set, and hopefully it'll stay that way for several years. I think we mentioned a program that Dennis or Dr. Broadway may have mentioned it, that we have a different set of funding from the state for communicable disease control and prevention. And with that, we are taking some of that money and buying the vaccine and administering it to the people that are at risk. And Dr. Broadway is assisting us with identifying those individuals. So that's a little different than this, and we're very, very happy to do it. We actually started it this past week and gave around, what, 33? Yep, so,
That's good. Thank you.
sure.
That figures up some things. I was wondering the same as well. So the action being requested is the fees to be added and recommended to the Board of County Commissioners. Is there a motion to approve?
Motion to approve.
Is there a second?
Second.
All those in favor say aye.
Aye.
All those opposed? All right, the motion passes. And we will move into the Environmental Health Division fee recommendations with Tracy.
So I have 2 fees for your consideration this evening. Both are well water sampling fees. One is an increase to an existing fees, and that is anion analysis, fluoride, chloride, and sulfate. The existing fee is $35, and just due to an increase in water sampling, equipment, processing, we're going to need to increase that fee to $80. And then the other fee is for the collection of well water and the analysis of up to 3 metals plus uranium. And that is a new fee, and we're asking $100 for that fee.
Previously, it was no charge to do well water for heavy metals.
We actually do not have this fee right now. We have another fee. It's an inorganic panel. It's a little bit more expensive. It's $130. So we are requesting this fee in some ways to allow for a cheaper method for someone to resample just for $100 rather than $130. So for example, if someone wanted to look at the big hitters in Union County, which are arsenic, manganese, and iron, it's just a little bit cheaper.
Oh, good, okay.
Is there a motion to approve?
Motion.
I will second it. And all those in favor say aye.
Aye.
Aye. All those opposed? And the motion passes. And then we'll have Tracy again for the NEHA FDA Retail Program Standards Grant.
Right, so this is a second stage grant from the one we had last calendar year. So this is track 2, a development-based grant funding, again through NEHA, which is the National Environmental Health Association, and FDA for additional work on our retail program standards. And it also includes some funding for staff to attend some enhanced trainings that they wouldn't otherwise be able to attend. And this is, more national, gives them the opportunity to travel to another state and get to know other folks in the field, and it's just been very impactful for my team. The maximum grant award is $12,500, taking both features into consideration, $5,000 for the program standards work, and the training is up to $7,500. No county match.
I'll make a motion to approve.
Second.
All those in favor say aye.
Aye.
All those opposed? And the motion passes. And that wraps up our division report. So we'll move into announcements and public comments. There were not any public comments. If y'all want to go around the room, and we'll start with Janet and do a report.
Right, I just want to provide one quick update. Stephanie mentioned an opioid settlement work group, and so just wanted to give you guys a little bit of information about that. The state of North Carolina is getting $757 million from the national opioid settlement, and Union County is going to get $9.4 million from that. Those funds will be distributed to us between 2022 and 2038. And we have put together a work group that consists of about, actually over 20 community representatives that are going to work together from August through December. And our plan is to provide requested information to the Board of County Commissioners by December 31st, 2022. Obviously not on December 31st, but by that time. And the group will prepare information and guidance that will hopefully help the board determine the best approach to use to make the best use of the settlement funds. And it does include people who are representatives from across the community who have expertise in opioids, in substance use disorders, in rehabilitation practices, and really across the gamut, from the school system, from the sheriff's office, from law enforcement, from the judicial system, as well as from therapeutic entities.
For public health, since Dennis is at the beach, we think, our clinics are going very well. Our new physician has started last month and is getting acclimated very well. She's very interested in learning all things public health, so we're happy about that. And, just we're trying to fill some nursing vacancies. And I was just going to mention the back-to-school exclusion clinic that we had that was a success, and then that we did start the rabies pre-exposure clinic last week. So we're very happy about both of those.
Hello, good night, good evening. At the request of our Deputy County Manager and Executive Director for Human Services, I've been working on putting together a group, and it's like a multidisciplinary team of individuals working on mental health crisis and response for our community. We know that is lacking. I think everybody in here knows that is a problem that we're dealing with. We're specifically at this point in time looking at our response for youth in our community. We're going to broaden that somewhat to adults. But current members, we've met once. Current folks that we have participating are from the District Attorney's Office, Law Enforcement, Daymark, Social Services, Partners, which is our LME MCO, Atrium, Union County Public Schools, the Department of Juvenile Justice, and the courts. And we have another meeting coming up about the middle of this month. And we're really just looking at ideas to proactively meet the needs of Union County youth and adults who are struggling with mental health crises, and figure out ways that we can fix what we can here in Union County. Because I think it becomes such an existential problem that we get so wrapped up in trying to figure it out across the nation, that if we looked in our communities and tried to put together unique ideas and creative solutions, we might be able to make a difference. And so that's what we're hoping to do with this team. And I'll report back as that progresses on some of the ideas we've come up with to work towards here in Union County.
What did you call that initiative?
I just made that name up. It doesn't have an official name. We've been calling it the Mental Health Crisis Response Team. It gets confused with our Behavioral Health Collaborative, because technically we are collaborating on behavioral health needs. So I think we're going to stick with Mental Health Crisis Response Team for now. So it sounds cool.
Good evening. Transportation has an RFP out currently for new scheduling software. That RFP closes on November 2nd. So hopefully by the beginning of the new year, we'll have a new software which will help us be more efficient in our scheduling and help more people in the community, we're hoping. We have a human service supervisor position open. This position will be making sure that we are compliant with all of our grants, helping us put in claims to those grants, and monitoring our budget. And as usual, we always have driver positions open.
Hi, good evening. Michelle Marcano, Veteran Services. We are gearing up for our busiest time of the year, of course, with Veterans Day coming around on November 11th. So we have already 4 events scheduled on our calendar. The biggest one is the opening ceremony to the Monroe Air Show, which is at 10:45 on Saturday, November 12th. Everyone's welcome to attend, please. And we're doing well. We're fully staffed and rocking and rolling.
So we hired the environmental health supervisor for the environmental health supervisor position. It was an internal candidate, so we're very excited about that. So then we'll post her position and backfill. We've also filled one of the environmental health specialist positions in the on-site program, which is very good news. It's a busy program and needs those extra hands. It takes a good bit of time to get someone trained and working independently in the field, so we start that immediately. It typically takes, up to 6 months or a little bit longer, depending on the individual. This coming up Monday, the 17th, is the open house for our CDBG grant funding program for septic system repairs. So that's going to be at the library in Monroe. That's pretty exciting. And one other note that we're working with folks from UNCC and NC State on the installation of a research well at Jesse Helms Park to study arsenic and possible treatment options for residences. So we're excited about that, and that's coming up in the next month or so.
All right, just have a few things. Everyone's heard me a little too much tonight. So we are still working on our emergency rental assistance program. We've been doing this for about a year and a half. We've distributed out just over, actually I pulled some figures, $7.5 million in both rental and utility assistance in the community to over 940 families. So like about an $8,400 average per family. And we still have over $2 million about $1.7 million from the Treasury, and then another $2.3 million from the state to distribute. So that's been going really well, but there's still a lot of need out there. And then just wanted to mention Christmas Bureau. We opened applications for a Christmas Bureau. We are struggling a little bit to find a space for our Christmas Bureau because we lost our space because another store is going into the space that we've been using the last 3 years. So we've been looking all over for space for that to be able to distribute out gifts, and we may have to separate and do it in a couple different locations, but it will happen. We'll figure it out. If you want to volunteer, there's a volunteer inquiry form on our website, and we could certainly use help with distribution and putting everything together. That's it.
No remarks here. Thank you.
Any other announcements? No? Is there a motion to adjourn? Is there a second?
Second.
All right. All those in favor?
Aye.
Ah.
Y'all have a good night.